So, welcome everybody that's joining us. This is Ask the Midwives Part 2. So the reason we've done Part 2 is last week was amazing. You had so many fantastic questions and we just felt that we weren't able to get to all of them, and we want to keep supporting you, keep just clarifying anything for you and just giving you a sense of comfort, or just helping you to feel more informed. There is a little echo, isn't there? I'm not quite sure what to do about it.
I can't seem to totally mute you on my phone.
Okay. Hi, Susan. Wish you were here.
Some echo, I
Okay.
think, from Shawn, it says.
Maybe mute me, Shawn.
On which?
Zoom. Let's try that.
How do I mute you?
Mute yourself. Mute yourself. Does that work?
How's that?
I think that's better. They'll tell us if it's not.
Hi, Susan.
So we're coming back. We've been inundated again with lots and lots of questions. Thank you so much for sending them in. I will do my best, as always, to get them answered, or Shawn will. We are joined tonight by just Shawn, simply because Shawn's at home and not in the hospital. We wanted to use the home Wi-Fi, not the hospital tonight. So we do miss Susan, though. Hopefully she'll be back with us. We'll do another one with Susan soon. So for those that have joined Parent Tribe recently, thank you for following. It's lovely to see you in this space. I'm Miriam. I'm the founder of Parent Tribe. I'm a hypnobirthing practitioner and a mindfulness coach for mums. I'm joined tonight by Shawn Dudgeon, who works for SASH Maternity and is based at East Surrey Hospital. She is the Intrapartum Matron there, and I shall pass over to Shawn just to tell us a little bit about her role at the hospital.
Thank you. I think we're still having echoey. Oh, I'm on mute. So can you hear me on Instagram okay?
Yep.
Yep. So is it still echoey for everybody?
Let's see what they say. I'm keeping it down.
And I'm wondering if people can hear me on Facebook.
Everyone's thumbs up. Go for it.
Okay. So my name's Shawn. I'm one of the matrons at East Surrey Hospital. My main focus is intrapartum care. So that means delivery suite, birthing unit and home birth team. And I have worked with Miriam for quite a few years, started to get to know her through the positive birth movement. So I've always been an advocate for birth and birth choices and giving women that birth experience that they deserve. I also set up the birth reflection service, so talking to women after they've had their babies where they've had difficult or traumatic births. So yeah, I'm very passionate about birth and after birth, of course.
Yeah, we love that you are, and thanks for joining. You're a little bit dark on Instagram, Shawn. I don't know if you've got a light that you can put on. Because we want to see your lovely face.
Let me go and turn my lights on, then you might see my messy study. Hold on, I'm going to turn the lights on.
Lovely.
Ta-da!
So remember to unmute yourself on Zoom, my love, so they can hear you on Facebook.
Yeah, I'm unmuted.
So everybody, I think it's important just to say that we are going to be addressing the policies and protocols in place at East Surrey Hospital. If you are due to give birth anywhere else, please know that you can speak to your midwife or your maternity care team, just to make sure that you have the right protocols and policies for your hospital. Okay, she's still on mute. It's so hard because we're getting so many messages. Can't hear Shawn on Facebook. You're not on mute. We can hear you. We can hear you. I think
I just turned you down on the computer, and that seems to have got rid of the echo. Don't know if anyone agrees with that. Is that better?
Okay.
You're
Much
not
better,
echoing.
can see Shawn. Fabulous.
Yay.
So I'm going to just say a massive, massive thank you. I cannot start this without saying a big, big thank you, not only to Shawn for joining tonight, but I think it goes from all of the people watching, a big thank you to our amazing NHS for everything that they're doing at this very difficult time. So thank you, thank you, thank you. So tonight I have broken everything down into different topics. We've had so many questions. I will stop every so often and check any questions that are coming through either on Facebook or on Instagram. So pop them in the comments and I will do my best to get to those as well. But Shawn, can you just update us on how things are in the maternity department at East Surrey? Since we last spoke, have there been any changes or any updates? And how are things over there?
So, yeah, so people are saying, oh, that's better on Instagram, isn't it? I was a bit dark down. I have to find something to put myself on now. So things haven't changed hugely in the service delivery. So we're still doing things pretty much the same. We're still trying to keep our distance and you know, make sure that we're only seeing women where necessary. So that kind of carries on. We're still doing lots of virtual clinics, which seems to be working well. The situation with our home birth service remains, so that's currently suspended. And we're in constant talks with South East Coast Ambulance Service to see whether that's going to be possible to reinstate that at all. But it's not at the moment. So be assured that we're doing absolutely everything we can and we're constantly reviewing the situation. The good news is for the maternity department is we've had very few COVID positive women, only 2 to date. So that's really good. We're just trying to sort of keep that transmission rate low where possible. So yeah, I think things have pretty much stayed the same. We've had some really interesting and positive feedback from women. I think one of the main concerns is around partners being allowed, particularly in the postnatal area. But actually, we've had some really nice feedback from women saying actually how much they've enjoyed spending time with other women in the postnatal ward. The staff have commented how women are much happier to have the curtains open so they can have a chat with each other. Midwives have got more time to spend because they're not letting in visitors and the ward feels a much calmer place. So they, although it's not ideal, they are sort of positive things, I think, that have been fed back to us, which is a
and I think that I think a lot of concern was around being on one's own and not having a partner there. And I think, you know, we were talking before we went live about how midwives totally empathise with that and understand that anxiety and that worry, and will do everything, go above and beyond to ensure that you do get that support. So should we talk about that? Should we come to antenatal care? And there's a few questions that have come through to do with that. I noticed on the SASH maternity pages today that you've opened the children's outpatients unit. Is that right?
Yeah, so the outpatient, children's outpatients is down by the east entrance before you get to the east entrance car park. So just as you turn into the visitors car park, there's a cabin there, you know, a prefab cabin. And so the community midwives are now seeing women there for the Surrey end of our patch. Obviously, Sussex remains in Crawley and Horsham hospitals. So yeah, that's been really positive. That seems to be working really well. So all of our community midwives are all sort of in a hub there. Which is what we eventually want anyway. And they're also
right. And so is that postnatal care as well, or is that just antenatal?
No, that would be post. So that's the 5-day Weighton Guthrie, so the heel prick test, and then they'll do a 10-day discharge clinic there as well. So yeah, everything is in there. It's quite big in there. They've got quite a few rooms. And then the plan is, hopefully in the next few weeks, is to look at one of the old GP surgeries, which is not in use anymore. And I can't quite remember the name of it, but it's in Red Hill somewhere. and the plan is to move it there, so it really is completely out of the hospital environment. Although actually it works quite well in East Surrey at the moment because there's no visiting, so the parking is not an issue, which has been an issue in the past.
Okay.
So yeah, that seems to be working well.
And will they have, if you have a named midwife already, will you still see the same midwife? Will that still be that caseloading or?
No. So the continuity of carer teams have been disbanded temporarily, just because it's too difficult to kind of manage people in their GP surgery. So the idea in the long run is to have these hubs where women can go to and have all of their care, and it's much more centralised, so it's a much more efficient way of working. But in the past, we've just never had access to the hubs themselves. So yes, there will be. It's not a huge team of midwives, so the chances are that you will get to know your team, because some of the midwives have come back into the hospital, because obviously when midwives aren't needing to travel around, you don't need the same number. So I think about 10 of them in the Surrey team, maybe a few more on the Sussex team.
So lots and lots of people message saying, and it's very case specific. My 32-week appointment has been cancelled, or as you explained last week, postponed. When am I seeing my midwife again? If I have questions, where's my antenatal support? What is your response to that for women that have all these questions around antenatal care? What do they do?
So you shouldn't have any appointments cancelled. So just to clarify that, if you are due to be seen for any of your appointments, we're not cancelling any of them. What we are doing is seeing you in a slightly different way. So we won't have all of it, won't be face-to-face contact. So some of the appointments, not many, will be a video call like this, like using the equivalent of Zoom or something like that. So there'll be a video call, or it'll be a telephone call to you to find out what's going on, how you're feeling. And they are just, I think, 1 or 2 appointments. I think 25 weeks and 34 weeks. They're the only 2 that we've really changed. But if you're having appointments cancelled and not rescheduling, you need to contact us. So the ways of contacting are, we've got the helpline, the COVID helpline, which is 9 to 5, Monday to Friday. We've got telephone triage, which is 24 hours a day. We've got SASH, the e-midwife, and then the community midwives all have their own voicemail. So please leave a message, because they will get back to you, definitely. But yes, scans shouldn't be cancelled. If they are cancelled, you need an appointment with the consultants to say why they're cancelling them. But we shouldn't be cancelling things. They might be slightly different ways of doing them, and consultants as well will make a decision as to whether they see you in person or they'll do a video conference with you, a video call. Okay.
I can see lots and lots of people saying my appointment's been cancelled, I've not heard anything, my growth scan's cancelled. Yeah. So
they shouldn't be cancelling. As far as I'm aware, I've just got the protocol in front of me where the changes were made. But as far as I'm aware, the 34-week appointment is still there, but it's being done as a call rather than a... So it says my consultant appointments have all been cancelled. But that you need to get in touch with your community midwife, because if you've got a consultant, you still need to be having appointments with them. Nobody should be having anything cancelled. So they're all going to be...
Or if it's non-urgent, will there be reason for postponing?
No, because all of our antenatal clinics are all still run by the same people in the same way. The only thing that has changed is that we're not seeing you face to face. So please, if you're having appointments cancelled, then please can you get in touch with your community midwife so that you can find out when you're going to be rescheduled.
Yeah, okay. Lots of people here saying that.
Here, actually. Okay, so it looks like they aren't seeing women at... So the current practice for 34 weeks is that we were seeing women as a face-to-face. They're not seeing you now at 34 weeks. So sorry, that's my mistake. So you should have a 32-week appointment. So 28 weeks, 32 weeks, then 36 weeks, then 38 weeks, then 40 weeks. Unless they've got if you're high risk for something. Yes, it looks like they are cancelling 34-week appointments. That's my mistake. Sorry, I've just checked in our protocol.
That's all right. No, that's great. That's what this is for. And
that's saying that pathway. So where you saw somebody face to face before, if you suffer with issues around your blood pressure, we've now got home blood pressure monitoring kits which are being given out. We've started a clinic today where women that suffer with high blood pressure will be asked to come in and have their blood pressure checked. But for all low risk women, there won't be a 34-week appointment. But for women that are high risk, they should still be seen or having.
Okay. If anybody, there's some people saying here, I'm worried that I'm going to fall through the net. No one's got back to me. The people are there to call, and I think you know, and people are stretched. I know the maternity services, you know, obviously you're working incredibly hard. If you don't get through or someone doesn't get back to you, please feel that you can chase. You know, pick up the phone and
I did.
Am I right, Shawn?
Community. Yeah, go back to if you ideally go to your community team as your first point of call. That would be the ideal, because they'll know you, they'll have their caseloads, they're going to understand when you need to be seen. If you leave a message and nobody gets back to you, I would say the next option is, if it's non-urgent, to email Sasha, the e-midwife, and she will get back to you within 3 working days. If you haven't had a response from then you know, we do still have the 24-hour maternity triage. So if you're really still not getting a response, then go through to the maternity triage. But there are those options, and there is the COVID helpline. So if you feel that appointments are being cancelled, and that's 9 to 5, that's one of our midwives who's working from home. So she's available Monday to Friday.
Keep your questions coming through. I'm trying to check them as we go.
All the 28-week blood sugar test, someone's just put that, the glucose test should be being done in Aldridge Blake, which is the antenatal clinic. They should be still being done there, as far as I'm aware.
Okay.
But there are still appointments there.
And there's never been a better time to, you know, really communicate with a midwife, you know, so to take responsibility and just communicate, work with your support that you have. If you're worried about anything or questions are unanswered, pick up the phone. Yeah. People are there for you.
We absolutely don't want anybody to slip through the net, and actually people that slip through the net tend to be people not realizing that there is a net to slip through, if you like. So they're often don't make that contact with us. So if you're worried about slipping through the net, that's a really positive thing, because it means that you're on the ball and that you understand that you're maybe missing something. So yeah, definitely get in touch. That's the way forward. And if you don't get any success at the first person, then come through to the next person and just keep going until you get some feedback, or you get an answer that you were looking for. Don't just leave it.
Yeah, or ask birth partners to chase, so you're not stressing yourself out.
Yeah, ask birth partners. Yeah,
definitely. Thanks, Shawn. So I'm gonna move on to birth. So a few questions here. So I wanted just to go over again. I did a post on this recently about what is established labour, but we've still had some more come through, and I thought it would be nice to hear it from you. This was a few ladies that are being induced. Yeah. What counts as established labour? Is it the same as a woman that's in spontaneous labour? Yeah. And this is all around birth partners being allowed to come into hospital when a woman is in established labour. So could you just go over, would you mind, Shawn, just going over that again?
Yep. So there's a couple of things around induction. One is that we are trying to move to as many outpatient inductions as we can, and is safe to do so. So if you're a low risk pregnancy and you're being induced because you're over your 12 days over your estimated due date by your scan, then we will be looking to induce you to bring you in to use the rods that we're using, that's just gently open the cervix, and then we'd send you home and wait for you to go into established labour that way. For anybody that's being induced for any other reason, and therefore is not low risk, we would bring you into the ward the same as we've, you know, always done. Use the similar procedure, and then to be honest, it's never been easy to always get it right. So established labour is generally two things. One is checking to see how dilated your cervix is, but probably more importantly is around your contractions, how regular they are, if they're frequent, and ultimately if you're needing you know, further sort of one-to-one care, possibly pain relief. So we take the whole picture, we look at all of that, and where we think, you know, that's the right time for women to be transferred over to labour ward, we usually do that in a sort of proactive way, so not leaving it too late. And as soon as you're starting to get those regular contractions, and we'll call your partner to come in, or you can call them to come in. I think what is difficult is that if you're uncomfortable and having tightenings because you've had the, you know, initial either the rods or the prostaglandin, sometimes that can sort of, things can happen and then it can all kind of fizzle out a bit. So what we trying to avoid is partners being, you know, for any length of time on the antenatal ward. So it's just trying to gauge that, and obviously we'll listen to women and how they're doing, how they're sort of managing. If someone's really struggling, we're not going to leave them struggling on their own. And again, much like the postnatal ward, the antenatal ward is quite a lot quieter. There's probably less inductions. Women are less keen to be induced because they don't want the hospital stay. So the ward has a much sort of calmer feel to it. So it's actually quite a nice environment. So again, I think women have had quite positive experiences there. Yeah. There seem to be the delays that they've been in the past. We've got our new special care, which opened on Saturday. So that now has the ability to take 23 babies, although that is a lot for them. But whereas before they were just 18 babies. So we've had delays in the past where special care haven't maybe been able to accommodate things. So that's all improved. So that's great. So yeah, labour would be around 4 centimetres dilated.
I think people can get quite bogged down by vaginal examinations and the centimetre and getting to a certain centimetre. Yeah. I think it's important just to say that you've only just mentioned the centimetres, and you've been talking about how do I know for the last few minutes. The point is that, you know, a good midwife will be able to tell just by looking at a woman what the noises she's making, how regular those contractions or those surges are. And then there's the number that can come with it. But it's that mindset, isn't it, that when I get there, I've got to be this centimetre, and actually you could be 2 centimetres and 30 minutes later you could be 6. So no one knows. It's you know, and I think women can get quite stressed about that, which is the opposite of what we want the body to do.
Yeah. So yes, it's the cervical dilation is probably the last thing we might look at, but I mean, it is important, but it's not the only thing that we consider. We take everything into consideration, and
then I think the most important. Sorry, Shawn.
And the main thing is how women are feeling, you know, and what we can do to support them. Yeah, and when you don't have a birth partner there at the beginning, you know, letting go of those numbers and just being in that moment, in the body, in the room, you know, and just not allowing the stress to creep in, that's going to be key. So when you think you've gone into labour, let's say you're at home and you've gone into labour, and maybe the surges are going, or the contractions, is it helpful to call ahead to the hospital? Yeah, so once you think your labour is establishing, so not just the you know, the sort of surges that you might normally experience, which are a bit uncomfortable, and you might have them of an evening and then it kind of tails off and you think, oh, is this it? Should I get my bag ready? No, nothing's happening. So you kind of relax and carry on. But once you kind of things start to sort of ramp up a bit and you think, actually, this is getting, you know, more uncomfortable and I think things maybe are happening, then use the 24 hours. Always use the 24-hour triage line. If you think you're in labour, don't use any of the other SASH or the e-midwife because you won't get a response. But yeah, use the 24-hour triage line and then let the midwife guide you through and talk you through. We usually keep you on the phone 5 to 10 minutes to sort of gauge how many surgeries you might have had in that time. So they're really good as well at assessing people on the phone. And again, if if you're feeling really anxious or uncomfortable, then we'd invite you to come in. If it's your first baby, we might suggest that different things for you to do while you stay at home, because we know that women birth better when they're, you know, stay home for as long as possible. And that really is about keeping upright. There's lots of distractions at home. You know, when you come into the hospital, as lovely as it all is, it is just those four walls. So it's good to stay at home, do what you would do normally. And then when you really think, oh, I don't know, I'm not sure I can, now it's really distracting me, I can't sort of keep going, then come on in. If it's your second, don't wait too long.
No. And if you are expecting twins, a lot of people messaged me this week expecting twins, and you're being induced, can partner come in any earlier, or is it the same policy?
It's the same policy for everybody, and the reason that policy is there, as I think I explained last week, it's about reducing that footfall into the hospital. And as I said earlier, at the moment we've only had 2 COVID positive women. Obviously that might change. We hope not, but it really is a bit like the lockdown in the rest of the country. The hospitals need to lock down as well, and I know it's really frustrating and disappointing and all of those things, but it's trying to look at the bigger picture and remembering that we're trying to keep all of you mums absolutely as safe as possible. And you've probably all seen the charts where if you just have contact with one person, then you spread to 15 people, but if you have contact with more people, then you just spread more and more and more. So yeah, it's just keeping to that same guidance, I guess, and using that same practice in the hospital as well. So obviously if you had a twin birth, whether that was an elective section, it would be the same for other women, so your partner would have a chance after the birth to spend a bit of time with you before they go.
Okay, great. Has COVID has it had an impact on the number of midwives available at the hospital or not? We've done quite well. I mean, I'll give you a sort of idea of SASH as a whole. We've got 905 staff off with suspected COVID or COVID positive. So that's the hospital wide. So there's a lot of staff, obviously, that are isolating. We have started testing. That started about a week and a half ago, and we're testing really quickly. So as soon as staff, you have to wait till day 3 of the symptoms, and then the results are usually back within 24, 48 hours. So the thing that's been a benefit to us is that some of the wards, like the gynae ward, has closed and their staff have been redeployed. So we've actually got nurses as well that are working on the postnatal ward that can be really useful, do drug rounds and that kind of thing, and observations. So that's been really good. So no, staffing is not an issue for us at the moment. It's been fine. And the way we've changed community, some of our community teams are now working in the hospital, which has been really good. And obviously our home birth team and our other continuity of teams have all been sort of displaced into different, parts of the maternity service. So hopefully if you were in the home birth team, you'll see a familiar face when you come in. Yeah.
Yeah, they're still trying to look after their women, so that's really good.
Yeah, lovely.
Yeah.
And I think I know the answer to this, but it has been asked. Can partners stay if you pay for a private room?
No. No, and in fact we're very limited actually we're not having private rooms at the moment on the ward. Those rooms are isolation rooms, so they're two of the rooms are specifically so that we can isolate women or babies that are, because obviously we've only had 2 positive, but that doesn't mean we've had we've had more than that are suspected, so those women need to go in those rooms, so the rooms are just for that at the moment.
Okay. I think a lot of the caesarean questions were answered earlier about scans and dates and things. So please contact your midwife about that.
Yeah.
How far in advance will you get your caesarean date if you're having an elective C-section? I think this lady says she's 38 weeks and she's not had a date.
So
do you know, Shawn?
Yeah, I think I mentioned last time that we're slightly changing the way. So the caesarean sections, they're trying to do two per day. Now, I'm not sure how far in advance they're letting women know, but you should know if you're 38 weeks and you're caesarean. So we normally do them around anywhere between 39 and 40 weeks. You should in the next 4 days. If you don't, probably best to phone your community team under a consultant. You might want to phone antenatal clinic, and they'll should be able to help you. But you will hear, and if you don't hear, let us know. Don't put him in here. So my husband's just let the dog in. Get him out.
We're live here.
Dogs don't understand that. Please let him out. Come straight in. Excuse the husband and the dog.
Postnatal. I'm going to move swiftly on. Not many questions coming up on. I'm just checking. We're all good. I hope. Am I? We're just. Oh gosh, there are. Okay. Oh my goodness, I haven't swiped. My goodness. Okay. Okay, I'll have a look through in a moment. Are there doctors easily available for an emergency caesarean?
Yep. So, nothing has changed in our delivery of care within the hospital, other than visiting for the postnatal ward. Nothing else has changed. So women come in, have their birth in exactly the same way, in exactly the same time. None of that has changed. So our team is the same size. It's made up of the same people. So that's all the same, just to reassure everybody. Nothing's changed as far as our labour care and the care on the postnatal ward. It's all the same. All the same policies are in place. Have GBS, or if you have meconium or your wards go more than 24 hours before you go into labour, we'd still recommend that you stay and have all the baby's observations done. So all of those things are still the same.
Okay, yeah, because there's lots. I'm just going through lots of questions about staff shortage, but it doesn't sound like there is, so that's great.
No, we haven't got an issue with staff.
Oh, that's a good question. So when waiting for a scan, social distancing, how
is in place.
How are we managing that with people? Is it yeah, that's a good question.
Yeah, so it's all quite obvious. When you come to the scan department, there is these little red dots that say 2 meters apart, and they're 2 meters apart. So a bit like you're queuing in Tesco's. Then they have those, so the waiting area is never crowded. I think they've extended the days, the times that they're doing scans, just to spread it out more during the day. So yes, there's social distancing, definitely. And you'll find, because it's only the woman coming, then that waiting room is nothing like it normally is, because normally it's got 2 people per appointment, of course, and maybe a child as well. So yeah, the waiting room doesn't feel at all busy, and we've got the blue chairs outside there as well. But it's all the stuff is in place for keeping that 2 meters apart.
Okay, fab. I think what I'll do, because there's so many questions coming up, I'm going to keep to my notes here, and then I can go through all of these. And again, what I can do is
Yeah.
you know, part 3, we can come back to
Yeah.
some great questions here.
We can just keep doing. I mean, if people, you know, feel that this is a benefit, you know, myself and Susan, certainly on a Tuesday night, are happy just to alternate, you know, doing these live sessions. And I know you've got kind of guest speakers, so our breastfeeding advisor is happy to, infant feeding advisor is happy to do next week, and we hope that our perinatal mental health midwife will do the week after on a Thursday. So if people feel it as a benefit, then we're more than happy just to keep going, and you know, hopefully women will have their questions answered and get some reassurance, really, that it's, you know, it is pretty much business as usual, just a slightly different way of doing business. Other than
absolutely,
the home birth thing is probably our biggest change, but everything else, you know, everything else is just as it should be. And ultimately, we don't want the, you know, COVID-19 is disrupting everybody's lives, but what we don't want it to do is have an effect on your birth experience or care that we're giving you. So if you feel that, you know, you're not receiving that care that you need, then please, I can't sort of stress enough, you need to contact us and we will do something.
And I know that women just want to see a midwife validating their emotions, actually, and understanding that this is unprecedented times. We know that this can really throw you emotionally and your anxiety, and that you are there for them for that. It's not just about being there on the day to help you have the birth that's right for you on the day. It's about the run up to it too. And I hope this is reassuring.
I hope, and as I said earlier, we've had some really positive feedback that, you know, a lot of our midwives are mums, and a lot of us have been through the experience, and I think, you know, we absolutely, completely and totally understand how frightening it is, how scary it is to not perhaps have the person with you that you want with you all the time. And I think, you know, midwives have really sort of, you know, they're very caring and compassionate anyway, but they've really excelled themselves in really feeling for women and understanding how frightening it is, and sort of, I think they've done really well in, you know, giving that extra care, compassion, not just our midwives, but our support workers, you know, everybody. And I think, you know, it's kind of a sense that we're all in it together. You know, everybody's having to have the same experience. It's not just one woman can't have her partner, it's the whole, everybody is the same. And I think there is that support that happens just naturally, because everybody's feeling that same uncertainty, fear. So we're all sort of working together and learning together, if you like, and just spreading that reassurance that actually it is going to be okay. That having a safe birth and mum and babies that are healthy is a priority for all of us. So and I do think there's that, we're all in it together and we'll get through it together.
Yeah, definitely. Lots of people saying these are helpful, so that's brilliant. We'll keep doing them as long as we need to. Talking of emotional health, well-being, for those that suffer with anxiety, maybe they are on medication for it, or perhaps they're even under the perinatal mental health team. What does the support look like for them, given that not having a birth partner there and having this very different scenario is a trigger for anxiety? Is their support slightly different, or is that a kind of case to case, talk to your support team, to the Maple team, whoever it might be?
Yeah, so the Susie is very much still creating plans for women. There's, you know, different situations, and it might be something around induction of labour, or because of, you know, there's lots of different things that she's doing to support women. The birth, obviously, itself, it's, you know, it's the same, although I know we've had women asking if they can have an additional birth partner, but it's, again, as harsh as it kind of seems, it is just that absolute protection for you, your baby, and trying to sort of manage. I guess it's about managing expectations and again just that individual support from midwives. So our Maple team are still working in the hospitals. I think probably the best thing is that we could do is to, and they work on both the in the birthing areas and on the postnatal ward, is to try and link women with one of the Maple teams. So there's usually one on per shift. So I think that would be helpful, and just have that sort of bit more of an understanding. But I think it's just back to what I said before. It's a very different environment to how it probably was even a month ago. You know, it's a much calmer place. The antenatal ward and postnatal ward particularly, it's, you know, it's quite tangible when you go onto the ward to feel the calmness. I'm hoping that in itself would be a reassurance for women. I mean, absolutely, on an individual case, if there was a really difficult situation, then we would have to manage that. So we do care for everybody. What I don't want to give anyone is a blanket.
No, of course not. Absolutely. And again, it's always about just working with you guys, isn't it? Than waiting for that call or waiting for someone to message you. It's be proactive about it. For those that don't know, what is the Maple team?
So the Maple team was created. It's a team of midwives, including our safeguarding lead midwife and our perinatal mental health lead midwife. And it's really working with vulnerable women, women that suffer with mental health. And they have a team of midwives. They have the two specialist midwives, and then they have a link to the perinatal mental health obstetrician and also a psychiatrist. So it's quite a wide network that they have, and they create really good, robust plans for women. And that's is still running. It's still available for women. So yeah, I'd say if you're in that team and you're feeling worried, then just contact them in the usual way.
And what is the usual way? Someone's just asked how to get hold of them. Do you know, Shawn?
So that would be via your community midwife. So if you're not in the team already, it would be a referral from your community midwife. I'm just seeing that. I've been waiting to hear from Maple team for 18 weeks and still not heard. Okay, so you've been waiting for 18 weeks. That's an awfully long time. Or are you 18 weeks pregnant? I'm not quite sure. But yeah, if you haven't heard from them, then go through your community midwife.
Okay, fabulous. Okay, so postnatally, oh goodness me, where to start? So if baby has to stay in for more than a few days due to health issues, can the father or partner or other mum come visit?
No, so it's the same. Yeah, it's the same rule. The special care have the same rules. It's one parent, just the mum, and it is just that footfall through the hospital, unfortunately.
And I think I had two questions about this, and I think this is quite helpful to clarify. If you haven't been to the hospital, you wouldn't necessarily know this. But when it comes to